Hi, this is Howard, and I'm here with Ashley and Joy to present our project on communication issues as they relate to those with hard of hearing disabilities in the healthcare setting. Communication. Let us consider that communication is one of the most important things in life. From the moment we're born, it's how we ask for help and for the things that we need to keep us happy, healthy, and well. Without the ability to communicate, life would start going downhill pretty fast. In fact, I'm sure we can all recall a time at work, at school, or at home, with our peers, with our friends, or with our loved ones, where miscommunication either caused us problems, inconveniences, or minor or major hiccups. Usually, a miscommunication, however, can easily be rectified by repeating ourselves or correcting what was misinterpreted. However, as nursing students and healthcare professionals, we are all well aware of the types of dangers that a miscommunication can create in a healthcare setting. The ramifications can be pretty scary. Yet, miscommunications happen, and communication barriers exist even in the simplest of cases with healthy patients. With doctors and nurses who are often pressed for time and are caring for multiple patients and who are used to speaking in medical terms and with lots of jargon on a daily basis, and with patients who are unwell, not at their best, and have trouble expressing their symptoms and complaints, it's no wonder that errors can and do occur. So now let's consider this on another level. How much worse would that be if you were deaf or had a hearing disability? So let's think about that for a moment. What does it feel like to be deaf or hard of hearing? Hopefully, the following video can give us a small insight into what it might feel like to be deaf or hard of hearing.
So when I was really young, probably kindergarten or first grade, I have a much older brother, and we'd go out to recess, and there was this older guy, he might have been in like 5th or 6th grade, that always used to pick on us. And I didn't really know what to do about it, and I definitely looked up and completely trusted what my brother did.
Today we went to a high school and I pet and held many different animals.
I was posing for a picture with all of my girlfriends when all of a sudden one of them reached over.
Can you read my lips?
Can you read
My lips.
Can you read?
It's pretty sobering and amazing how just a short clip of video can really put your life into perspective and make you realize how lucky you are. We're now going to hear from Joy, who's going to drill down into communication barriers and problems that those with hearing disabilities face in a healthcare setting every single day.
Hello, my name is Joy, and I'm going to be talking about the problems in the deaf of hard of hearing community that they face with communication in healthcare. So, members of the deaf and hard of hearing community face numerous challenges on a daily basis. According to Cohen, Gabriel, and Terrell, a lot of disparities happen for this minority group, specifically in healthcare. They are impacted more severely than those outside of their community by the inadequate communication they face in the healthcare setting. From a deaf and or a hard of hearing patient's perspective, they have trouble adequately describing symptoms to their providers. They have difficulty displaying the full range of their pain, emotions, questions, and concerns. And they frequently do not understand routine orders such as taking prescribed medications and attending follow-up appointments. This also can lead to deaf and or hard of hearing patients not being proactive with their health. Not being proactive with their wellness leads to the following consequences: neglecting diagnostic tests, preventative medicine, and approaching physicians in specialized fields such as dermatologists, OBGYNs, gastroenterologists, oncologists, those who do diagnostic imaging, and so forth.
Thanks, Joy. Let's have a look at what that might look like in an actual clinical setting.
are you?
I'm her friend.
If you're not family, you can't be back here.
Why haven't you told her what's going on? She's completely confused. She's deaf. She needs an interpreter.
Can you do it?
Yes.
Tell her she has a possible fractured pelvis and she needs an MRI.
Her back hurts. She's a 7 on the pain scale.
Okay, tell her I'll give her a painkiller.
She's allergic to Dilaudid.
Good to know.
What's going on? Why isn't there an interpreter here?
We're working on it.
Excuse me. You need to face me, please.
We don't have a contract with an interpreter service on the weekends.
So deaf people shouldn't get hurt on the weekends?
It's not my policy.
What about a video phone? You're supposed to have one of those.
We do. We're trying to track it down.
So you just left her completely in the dark about what's going on?
We're doing the best that we can.
Well, obviously it's not good enough. I mean, what if you had given her Dilaudid?
Look, this doesn't happen very often.
It's happening now!
There are no doctors or nurses here that know sign language. All right?
Well, there should be.
From a physician's standpoint, challenges arise for the deaf and hard of hearing because it is difficult for physicians to ask the right questions to this patient population. This communication barrier is discussed by Dr. Joseph Hang of Johns Hopkins. He emphasizes the reality of critical information being lost, which becomes a matter of potentially violating patient safety. Prognoses, assessments, treatment plans, orders, and prescribed medications can be more detrimental than helpful if the patient is not prioritized by being properly understood. This disservice by providers occurs when tools, props, interpreters, American with Disabilities Act compliance, and visual aids are not utilized for the deaf and hard of hearing patient population.
Language can be an obstacle to obtaining healthcare services. The deaf community has its own set of challenges, which includes both language and cultural barriers. But there are resources available to help this underserved community gain access to the information it needs to stay healthy.
Hi, nice to meet you. My name is Dr. Regina Wong. I chose to go through the ASL program because I have deaf family members that I grew up with, my aunt and uncle, and I realized that they had many barriers to accessing healthcare because they could not speak to their providers in their first language, which was American Sign Language. It is very challenging to communicate with patients who are deaf because many of the terms used in medical English, there isn't a term for that in sign language. As a result, through the program I went through, they had to teach us ways to describe organs, describe medical conditions, not just through signing, but also through gesturing. A lot of times I draw pictures for patients or even use Google Images to point out medical parts and describe illnesses better.
Thank you, Joy, for walking us through that. Now, Ashley is going to tell us about some of the solutions for those who are deaf and hard of hearing in a healthcare setting.
Hi everyone, my name is Ashley and I'm going to discuss the solutions for the deaf and hard of hearing community in healthcare. Fortunately, there are many solutions to this issue in healthcare. This is an important issue to address and work on improving, as this community of people deserve to be treated equally. The first thing that healthcare facilities can provide to the staff members is education and awareness on this health disparity and communication barrier. all healthcare facilities need to work at establishing an effective communication office policy that includes an ASL interpreter always being present. Facilities can also have on-call interpreters. According to the American with Disabilities Act, all healthcare facilities are required to provide an ASL interpreter as the first line of communication. As healthcare facilities get their staff members on the same page, everyone can begin utilizing charts, diagrams, props, visual aids for the hard of hearing and deaf patients. Having a brochure with a list of online resources will also be beneficial. We cannot assume that patients understand what we are saying through lip reading. We need to identify the patient's preferred method of communication and their communication needs by directly asking them. Keeping eye contact with them and speaking directly to them, even if an interpreter is present, will make them feel appreciated and important. Also, using the teach-back method will ensure that the patient understands the doctor's orders. According to a survey conducted by Holmes, Borash, Hartwig, and DeGracia, 81% of the interpreters in the survey mentioned that healthcare providers rarely use the teach-back method when communicating with this community of patients. The survey also concluded that only 22% of physicians have used ASL interpreters ever. Additionally, preparation is key. Healthcare facilities can prepare for the upcoming day if they identify at-risk patients for poor communication. Adding a simple pop-up or alert into their chart will make all staff members aware of their special need and to ensure that enough time is allotted for their appointment. Lastly, all staff members need to welcome these individuals with open arms. This community of people are known to not seek much medical help or participate in preventative services due to their lack of trust and them not feeling empowered. We, as healthcare providers, are providing a disservice to this community of patients as we are not properly communicating with them and offering the best quality of care. Providing a welcoming environment will help to build trust and establish long-lasting relationships.
Thank you, Joy, and thank you, Ashley. I think we've seen from Joy's portion of the presentation that the evidence is compelling that deaf individuals have insufficient access to healthcare. And also, from what Ashley has presented, that this results primarily from communication barriers in the healthcare system itself. Therefore, to conclude, it's time to move beyond the identification of the barriers and into generating realistic solutions that can be applied every single day. Access in the form of effective communication for the deaf and hearing impaired must be created and consistently provided to create an optimal healthcare system that embraces the needs of everybody.